Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Today we're answering a very common question. Will Medicaid pay for medical marijuana? The short and direct answer is no, and we're going to break down exactly why. The biggest reason comes down to a conflict between federal law and state law. At the federal level, the U.S. government classifies marijuana as a Schedule I controlled substance under the Controlled Substances Act. This classification means the federal government officially considers it to have a high potential for abuse and no currently accepted medical use. Now, let's look at Medicaid. Medicaid is a joint health insurance program funded by both the federal government and individual states. Because federal money is a huge part of the program, Medicaid must follow all federal laws and regulations. And since marijuana is illegal under federal law, federal funds simply cannot be used to purchase it. You might be thinking, but wait, medical marijuana is legal in my state. That's true for many states across the country, but that's where the conflict comes in. A state's law legalizing medical cannabis does not override federal law when it comes to federal funding streams like Medicaid. So, even if you live in a state where medical marijuana is completely legal and regulated, Medicaid is still bound by that federal restriction and cannot pay for the product. However, there is an important distinction to make. While Medicaid will not pay for the actual marijuana product from a dispensary, it might cover the cost of the doctor's appointment where you get your recommendation or certification. A visit to a qualified physician to discuss a medical condition is a legitimate medical service. Whether this specific type of visit is covered depends entirely on your state's Medicaid plan, so you would need to check with them directly. But remember, even if the visit is covered, Medicaid will not pay for any state registration fees for a medical card, and it will not pay for the cannabis itself. There is one other area to be aware of: FDA-approved drugs. Medicaid can, and often does, cover prescription drugs that have been approved by the Food and Drug Administration and are derived from cannabis compounds. A good example is Epidiolex, which contains cannabidiol, CBD, and is used to treat certain severe seizure disorders. These are not considered medical marijuana. They are fully vetted pharmaceuticals that have gone through the rigorous FDA approval process, so Medicaid can cover them just like any other prescribed medication. So, to sum it all up, number 1, Medicaid does not pay for medical marijuana products because marijuana is still illegal at the federal level. Number 2, it might cover the doctor's visit to get your recommendation, but you need to check your specific state's policy. And number 3, it can cover specific FDA-approved prescription drugs that contain cannabis-derived ingredients. This means that for now, patients who use medical marijuana will have to pay for the actual products out of their own pocket. Thank you so much for watching. I hope this video cleared up the confusion on this complicated topic. If you found this information helpful and want more straightforward answers to your healthcare questions, please hit that subscribe button and give this video